At a national level, we received from the Pan American Health Organization, the World Health Organization Dengue Diagnosis, Treatment and Control Guidelines. And those are the 2009 guidelines. Those are guidelines that would guide our technical professionals, our medical professionals, in terms of diagnosis and treatment of persons who present with signs and symptoms of dengue, and then further to guide them in the treatment protocols. What we have done as a Ministry of Health, we have utilized the guidelines sent by the World Health Organization, and we have adopted them and formulated them as national guidelines for diagnosis, treatment, and care of persons with dengue. You would see one of them on the wall over there, that pretty poster. That is an algorithm that's a quick reference for our doctors. It has been circulated to all our chief executive officers in the regions who have responsibility for the health facilities there, as well as the county medical officers of health and the medical chiefs of staff of the hospitals. And so that is now available to be placed in the treatment areas to be a quick reference for doctors in guiding the process. That's one of the things. We've also engaged in production of a number of health education material, both targeting our internal public, our medical staff, our nurses, etc., and our external public, and that's the public outside there. We have produced a number of material. This one is what we call home care guidelines. These guidelines will be given to persons now when they come into the facility if they're suspected with dengue, and they can go home and take particular action and monitor certain symptoms. These will guide them, okay? And we've also developed information for the general public. This is just on dengue, and this would be all your frequently asked questions, all the things you want to find out, and these are being distributed as we speak. So we've developed a number of public education material, posters also, that we are circulating to our various publics, internal and external. At the regional level, we continue to have a robust program of health education, and we are using a number of strategies. We have the local, the public broadcasting, using the vehicle going around with a loudspeaker. They have been going to all the areas that have been identified with high indices. Now, we get this information from the Insect Vector Control Division. Any area that has indices over 5 is liable to have transmission. And so we target the areas with the high indices, and we do what we call public broadcasting, focusing on source reduction. As Dr. Tilakdari said, that is the key to our message, that we need to take responsibility of the environment in our homes and as a community, those around us, in the village, on the street you live, and get rid of the mosquito breeding sources. So that's what that is all about. Along with that, we have the public health inspectors from the community health services within the regions who have been engaging in public education targeting community-based organizations. I support it, and most of these lectures and discussions within communities, however, they are supported by the community health services and the public health inspectorate. We want to acknowledge also the support of local government and the regional corporations who also have a public health department, and they have been engaging in public health education. Now, the school term is coming. It's going to be open soon, and the Minister of Health is leading the development of an initiative targeting children. We will discuss that in much further detail, but that is going to be a comprehensive program where we are going to utilize children, prepare them so that they can support their parents in getting rid of mosquito breeding sites in and around their homes.